Hello, everyone. Welcome. We're so glad to have you here with us today for this latest part of our 2020 Practice Comeback Plan, where we are going to be looking at answering your questions. I'm realizing I have the wrong deck up. Okay, well. I am going to go through some housekeeping items while I work on getting the right deck up. I am so sorry. That is really funny. Totally my fault. And that is just yet another in the long list of technical issues we all face as we move everything into sort of this digital approach. You're all getting a chance to see my daughter's lovely artwork in the background here while I reopen PowerPoint with the right deck. I apologize. We've been doing a lot of webinars and talking about this content a lot with different groups, and I happen to have two decks going on at the same time, so I apologize for that. I am going to quickly introduce myself while we get this one going. So my name is Leah Chatham, and I'm the Content Marketing Director here at Solution Reach. I have been doing education for providers and their staff for about 20 years now. And I also did work for about 5 years at a small integrated health system where I did mostly practice marketing and patient engagement and that kind of thing. So that's my background. And I'm joined by two of our resident experts here at Solution Reach, Addison Reed, who's our customer education manager and the man with the coolest beard here at Solution Reach. He does a lot of the education that you see on our community. And also was an office manager for a while, so has some good boots on the ground kind of experience. And Lori Boyer, who is our senior content writer, she has also been working in doing education and marketing and healthcare for a long time. Many of you probably interact with her or see things that she's created through our blog, through our FAQ video series, and other content that comes out from Solution Reach. So all of us have kind of a variety of experience that we bring to the table that we've been sharing during this time, and hopefully you'll get some good insights today, and that will be our only technical issue. So, it's good to have it up front. I do want to mention a couple of quick housekeeping things. First of all, we do want you to ask additional questions as we're going along today. We did sort of aggregate together questions from all of the webinars and other places where we've been receiving feedback from people. And we tried to pick out the ones we were seeing most commonly, so we are going to answer those. But we would love for you to be asking questions on those topics as we're going along, and we'll do our best to answer as many of those as we can during the webinar. And then if we have a little bit of time at the end, we'll see if there's some additional questions we can get in. Just click on that little arrow next to the word questions, open that up, and drop your question in. There are a few common questions that we get that I want to address quickly. The first one is, usually people are wondering if they can get the deck. We didn't load the deck up this time because it's just a series of questions. There's not really any additional content in there, but you will get a link back to the recording after today's webinar. So if you're wanting to share this with anyone, you will get that via email, and you can send that out to anybody else you think might be interested, or you're certainly welcome to listen to it again yourself. Also, I would recommend you consider connecting with us on social media in terms of being able to find other resources or things that are going on. We post a lot there in terms of kind of the latest and greatest on what's kind of going on in the industry and programs like this one. If you have support-related questions, we would encourage you to go to community.solutionreach.com, click on My Support, or email community@solutionreach.com. Also, often common questions can be answered by just typing the question in and looking at the knowledge base articles. There's a ton of knowledge base content in the community. So if it's support-related, please take it there. We won't be able to answer support-related questions here. Finally, the last question that we often get is people having difficulty with their audio on the webinar. So what we recommend is if you are listening to this on your computer and you do find that you're having some audio problems, click on the arrow next to audio and switch from computer to phone and dial in. That usually is a good way to resolve those problems. All right, so I think we've covered most of our common questions. Our agenda today is pretty simple. We're going to be answering your questions. So like I said, we've kind of taken a bunch of common questions we've gotten over the last 6 weeks or so, put them into this deck to address those. And then, of course, we'd like to answer any additional questions you have as best we can. We are going to start out with one of the hottest topics that we are addressing right now. For many healthcare providers, telehealth has really taken kind of a front and center place in trying to provide care for patients, and people have a lot of questions, given that many people have really not used telehealth before. So it was a very small percentage of healthcare organizations that had any kind of telehealth in place. And now we are finding that, really almost everybody does. So it's a little bit different based on what specialty area you are in, obviously. And so we have different sets of questions coming in from people. There were some very general questions about telehealth, as well as some very specialty specific questions about telehealth. So for our purposes today, talking to dental practices, Lori has actually been doing quite a bit on that. And I'm gonna kind of facilitate here while she does a little bit of answering on questions. So Lori, one of the most common questions we've been getting is really just how can dental practices be using telehealth right now, if that's something that they need to be doing to see patients?
Right. And you know what? It's interesting because for me, that was probably my first thought too. Like, how can the dentist even do telehealth? Because I need you to clean my teeth and fill my cavities. But turns out there's lots of ways. If you guys have things that you're already doing, I'd love to hear them in the comments as well. Pop in and say things you're doing. But typically, screenings, consultations, education, follow-ups. You gave somebody a root canal, you can absolutely follow up and talk about pain issues and whatever remotely. Lots of cosmetic stuff. So if you are doing orthodontic stuff, a lot of those kind of consultations are taking place virtually. And of course, a lot of this can be that you hop on and you can discuss if somebody needs to come in and be seen in person. I've heard cases of people who are showing, whether this is, video, so you're kind of showing inside your mouth, whether it's sending pictures in or whatnot, but, showing kind of some trouble spots like, oh, this tooth is broken off, or I'm feeling like maybe I've got an infection, or I've got this sore in my mouth, all of those kind of sort of more issues where you might need medication or whatnot, those can be prescribed that way. And so there's actually a ton of ways that you can use telehealth and virtual visits in a way that's really effective. And then obviously saying, hey, looks like this needs to be seen, so come on in. So accuracy is another question. I actually have received that a couple of times. So if you're diagnosing something virtually, how accurate are you? And so I did some research on this question, and actually there have been multiple studies on this. These are pre-COVID-19 studies, but they found that your virtual diagnoses are actually very accurate. 2017 study from the American Medical Directors Association of Teledentistry found that where they were doing it, they had excellent accuracy in diagnosing dental pathology. In addition, when these dental practices had offered some of these telehealth options, it actually led to more regular checkups, more early intervention if there were issues that the dentist may have seen. A study in the Pediatric Dentistry Journal found that using like an intraoral scanner as well as a virtual visit together was just as accurate at finding cavities as an in-person checkup. I thought that was really cool. And a study in the Journal of Telemedicine and Telecare found that diagnosis of mouth lesions was done just as accurately virtually as it was in the office. So there's a lot of ways that you can do it. And finally, do patients even want to meet with you remotely? And overwhelmingly, the answer to that is yes. It gets rid of a little bit of that fear factor. I know that you guys working in the dental industry have to deal with that fear factor all the time. But 78% of patients This is pre-COVID, the end of last year, 2019. They did a big study and asked patients, hey, are you wanting to use teledentistry? Are you willing to? And 78% said yes. And this is before the pandemic, where we've seen huge rises in the number of people, seeking out medical and dental and everything care virtually. So these are some of the kind of more generic dental telehealth questions. We have a lot more information on codes and billing and that kind of stuff in some of our guides. So you're welcome to look at those if you want to as well. Anything else that Addison or Leah, you wanted to add about telehealth or teledentistry?
Yeah. I was going to say, so, the ADA is providing a lot of guidance on the billing piece. So if you're looking for, we do have some general information out on our blog and in our resources, but it's very high level. Billing is not our core area. So I would definitely recommend looking to really, resources like the ADA for better guidance on that. We did just have someone post some additional ideas about kind of follow-up and emergency screening and those kinds of things. It was interesting, actually, the person who posted that also suggested collaborating with referrals as a way to use telehealth. I do want to remind everyone that the rules around your interactions with patients versus your interactions with referring providers are different when it comes to HIPAA. So in the case of being covered entities, when you're collaborating with referring providers, you are both covered entities. And so the level of security and the rules about what you can and cannot share are different as both being covered entities versus when you are interacting with a patient, you are a covered entity, but the patient is not. So patients can more freely sort of discuss and share information with you. Patients can consent to sharing information over unsecure tools like unsecure text or unsecure email. That is not true in a referring provider relationship. So please keep that in mind when you are sort of thinking about how you use these tools between you and your patients and between you and other providers, because you do have slightly different rules there. So I'm glad that person kind of brought that up as one of the ways you can sort of collaborate or communicate in addition to working with patients, because it is a little different. Okay, so moving on. One thing we did want to mention, and because this has come up and it came up so often in our previous webinars, is that as a result of feedback from our customers, we have developed SR Telehealth. This is a HIPAA compliant, secure, high resolution video tool that can be launched using SR Conversations, so launched from text. These visits can be pre-scheduled, and then you send a text right before the visit with the link, or they can be done on demand. If you're doing sort of a text check-in and it seems clear from the check-in that you need to actually have a virtual or a telehealth video visit, you can actually launch that right there and make that transition. We do want to just quickly ask if anybody would like to have more information about SR Telehealth. If so, we can have somebody follow up with you. So I'm going to launch a quick poll around that. We are seeing that a lot of people have kind of struggled to find a tool that they can quickly get set up and get in place during this time, especially if you're planning to continue offering sort of a combination of telehealth and face-to-face visits for the foreseeable future, and wanting to make sure that you've got something in place for the long term that is HIPAA compliant and secure. So we'll let that run for just a couple more seconds, and then anyone who says yes, we will certainly make sure that you're able to get that follow-up and somebody reaches out to you to talk more about that. Okay, so looks like the voting is sort of slowing down. We'll get it maybe 5 more seconds. Okay, so I'm going to close that. And again, we'll make sure that if you said yes, that somebody follows up with you and you get some information about SR Telehealth. We know that that's really a priority for a lot of people right now. So moving on, we're going to hit on a few different categories that sort of fall under this patient communication topic. And that is, oh, and I just had a question. Okay. So this is actually a good reminder. So somebody just said in Georgia, the Board of Dentistry has said you cannot provide telehealth after May 13th. So this is an important note that has come up quite a bit, especially in dental, because not every state allows teledentistry. Over the last 10 years or so, pretty much all states have moved towards allowing telehealth for medical, and that took quite a bit of work to kind of get there. Right now, I think it's about 2/3 of states in the U.S. Allow teledentistry of some kind, while others do not. And then some have lifted some rules during this time to allow for teledentistry just in this pandemic period, and those rules vary from state to state. So it is really important that you look at what the statutes are currently and then moving forward for your state, as well as for different payers. So while Medicare and Medicaid, most Medicaids have followed Medicare, right? So there's 50 different Medicaid providers, one for each state. Medicare has lifted a lot of restrictions, and most Medicaid providers have followed suit. Many commercial payers have also followed suit, but not all of them. So it is really important to make sure that you are verifying with all of your payers and with your state what the statutes, rules, and regulations are so that you can be compliant. It is more complicated for dentistry, which is unfortunate, but there's not a lot we can do about that. Okay, so moving forward, talking about text messaging, which is another tool that has really come front and center for many providers as a way to communicate quickly and easily with patients. We do get a lot of questions about that. And, you know, one of the most common is this question about most of our patients are seniors. We're not sure they'll use text messaging. Lori, this is something you've written a lot about. So I'm going to let you take this one again, and then we might have Addison jump in here to talk a little bit about our specific tools. But give us some feedback here on that hot button question that we so often get.
I just say too, my parents are both in their 70s, and my dad worked for the Forest Service his whole life, and my mom was a counselor, and so they're not like tech people, but they totally use cell phones all the time, like more than me, I think. And so I think sometimes we get kind of this outdated idea that our seniors don't really text, but it's just not true. I mean, you'll learn from me. I'm kind of the data nerd, the numbers gal, but 80% of people over age 65 have a cell phone, and the vast majority, 86% of those, are texting all the time. So I think generally the answer to your question is yes, seniors do use text messaging. Now, of course, and this really goes for any age bracket, there are going to be those exceptions of people who don't text. And I think especially as you're getting into the really elderly, you know, we're talking the 80s, 90s, 100s age categories, you might find that some of those don't text. So my recommendation, as always, is always one of my recommendations, ask what their preference is for contact. If hopefully they'll select text messaging. If they don't, then you're going to have to reach out in alternative ways. But typically, yes, seniors use text messaging just as much as the rest of us for the most part. So that's my answer to that.
I'm going to piggyback off that actually.
Okay, let's hear.
Oh yeah, go for it, Addison.
So even when you have, and we experienced this in my practice, we would have patients who, you know, they would indicate, hey, I prefer an email or a phone call, and we say that's totally fine. But we take a moment to try and educate them, you know, in a brief manner about, like, have you seen how quick and easy it is to text? Because this option's available. Think of it. Let me put it into a different context for you. If someone, you know, if a patient calls to cancel an appointment, which, as we all know, happens every single day, you know, ideally you want to get them back on the schedule. You don't want to just say, like, oh, that's okay, Mrs. Jones, you know, we'll let you off the hook. You know, we'll cancel that appointment, and you just contact us whenever you're ready. That's okay, but that's not really ideal. The ideal situation is to say, hey, let's get you back on the schedule. What day, what time works best for you, right? Think of that same type of tactic in this instance where, you know, I really prefer a phone call or an email maybe. And you can say, hey, that's fantastic. Have you seen how quick it is to communicate with us on text messages? Let me send you one right now, in fact. And we had a really, good, lots of good opportunities in those instances to kind of show them the convenience that we were providing to them as patients. And for some, that was enough to convince them, you know what? Yeah, let's do texting. Let's see how this works. You guys are still gonna allow me to, go back to my phone calls if I want. Yes, of course, But the vast majority never went back to preferring a phone call. They stuck with text. So take those as little tiny teaching opportunities here.
I
Yeah,
think
and
that's
I
a
think
great
that
point.
actually,
Oh, sorry, go ahead.
sorry, relates to the next question we have, which is that, a lot of practices face this challenge about over time, maybe they send out some newsletters or they send out something, that for whatever reason, people opted out of text messaging. And we've been getting a ton of people asking questions now, well, what do I do now that we have to communicate with people so quickly and things happen so fast? And, we have these people who opted out of text messaging and we're worried they're not getting these other messages. How do we get them to opt back in? And it's kind of the same thing. It's about sending some kind of communication to people, in email or phone calls or whatever, where you're saying, hey, things are changing quickly. It's critical for us to be able to reach you, and really just helping them understand why it's important for them to opt back in to receiving those text messages. And if you can communicate that well, you are much more likely to have people respond to that and opt back into receiving those text messages, because of course people want to be able to get that information right now. They understand that this is an unusual time, and that the whole reason for having the text messaging option is to be able to communicate with people quickly and easily and back and forth with questions and all that kind of stuff. And people don't want to have to wait on hold. They don't want to call. It's really just about explaining to them why it's important for them to opt back in.
And I think
Sorry. So what
I
were you
wanted
going
to
to say, Lori?
say, yeah, that ties as well back to our seniors and what Addison was saying about education, because the one area I do see that seniors may be texting, but they may not always be aware that they can text their doctor, their dentist, businesses, things like that. They may think texting is just for family or something. So education is super key. What Leah was talking about, it applies the same for initial getting people to opt in as it does if they've already opted out and you want them to come back. Educate them, put on your voicemail message something saying, hey, look, we really want to be able to reach you as quickly as possible, especially, during this COVID-19 crisis. So we can text, let's opt you in. You can send us a text message, include it on your social media, include it in newsletters, include it in signs in the office. There are a lot of ways that you can just encourage people and educate them on the ability and importance of texting.
Yeah, for
I
sure.
have more to piggyback on that real quick.
Oh, yeah.
So for those of you out there who are Solution Reach customers, I want, if you have this question, if you have patients who have opted out, there are a few different ways that you can get them opted back in. And you can go to our community, which is community.solutionreach.com, and just type in the word opt, or the words opt in the search bar. And that very first result should be this article that's titled, allow patients to opt back in to receive text reminders. You can even, go to Google and type in Solution Reach opt-in, and one of the top results should show up in Google with that same link to the article. But along with that, in our platform, you have reports that you can use that show you who is opted in and who is not. You can even look at what types of devices these patients have. A lot of the times these opt-outs happen on accident. We see this all the time. A message gets sent out. I've done it myself a few times. A message gets sent to me, and it's reminding me of my appointment, and I mistakenly respond with wording that I'm trying to say, hey, I need to reschedule or I need to cancel that appointment, and I end up opting out on accident. So I have to call the practice and say, hey, what do I need to do to opt back in? So there are lots of options here and lots of reporting tools as well, so that you can see how effective the spread is of your messaging across different device types. And we have articles for that.
And that was a question we were getting from people Addison. I'm glad you touched on that because it was going to be my next question for you was people asking, well, is there a way for me to see who's opted out? Yes, there is.
Absolutely, yeah. And we have
and
we have
another
articles that show you how.
Yeah, and another really important question that we've been getting a lot from people is, hey, can I still use conversations for these two-way texting things while my other messaging is turned off, like my automated reminders, automated recall, whatever? People sometimes have said, like, well, can I keep one kind of messaging on versus another? And this is really important, Addison, to just confirm that, yes, you can have different features turned on and off within Solution Reach, right?
Absolutely. Oh yeah. As many of you probably experienced, we had a big influx of communications to our support team that said, right when all of this hit, they said, hey, we are shutting down. I need to turn off my automated messages. So we said, great, we are totally happy to fulfill that request for you. And in fact, there are now ways to turn off messaging directly in the platform. You don't even need to contact our support team to do that. You can do it independently. We realized, man, we need to give you guys a little bit more independence here. So we made that change. So you have those opportunities and those methods to turn off and on messaging of different types right in the platform. But along with that, even if the automated messages are turned off, text messaging through our tool is SR Conversations. That's manual. You can absolutely send out messages manually. You can send out your newsletters. You can send out group messages. You can, anything that can be sent manually, you absolutely can and probably should be using right now. As we've talked about in different portions of our comeback plan, pull these different levers, right? To reach out to your patients and communicate updates, whether you're, hey, we're still seeing patients for emergency appointments, or hey, we're planning on opening on this day. Use all these different communication methods to reach out to the patients and communicate with them.
Yep, and it's great. You have a lot of options and a lot of flexibility, which does kind of bring us to the next big thing, which is challenges around reminders and all the different things that have sort of been going on. Obviously, most of you have been canceling batches of appointments over periods of time, a week at a time, 2 weeks at a time, 3 weeks at a time, whatever may have made the most sense for you. And now we're looking at, of course, people starting up again and needing to get back to work. And one of the most common questions we've been getting is, hey, if your recommendation is that we'd be sending reminders 3 weeks out, 3 days out, 3 hours out, what do we do if we're turning things back on and we have appointments coming up in a week? And Addison has some good suggestions about sort of how to make sure that you kind of get those reminders turned back on best we can. So Addison, do you want to share some of those suggestions around that?
Oh, you better believe I do, Leah. So you're absolutely right. Our recommendation for quite a while now has been that 3-3-3, right? Send out appointment reminders 3 weeks, 3 days, and 3 hours ahead of the appointment, and we have that backed by tons of data that is going to result in the best confirmation rate possible for your practice. Now we're in a little bit of a different bind right now. And some of us, we may be reopening with relatively short notice. So what you may want to do temporarily is adjust that 3-week reminder down to perhaps a 1-week reminder. So for example, it's a Thursday right now, it's the 14th. Let's say that we are going to be reopening on the 25th of the month. So not next Monday, but the Monday after that. Okay, what I would do is I would turn on reminders and I would modify that 3-week and I would change it to a 1-week so that I'm still messaging patients 1 week ahead of time, 3 days ahead of time, and 3 hours ahead of time. As many of you are probably realizing, or have already realized when, if you've been shut down for and only able to see patients for emergency appointments and things like that, you need your confirmations to be on point. When a cancellation or a no-show happens, especially right now, you're probably really feeling it, and and that can be very frustrating, because you have staff there at the practice ready to treat a patient, and maybe it's we've also recommended don't double book right now. Maybe you need to stagger your appointments a bit more. And so if you have a large empty block where no patient is coming into the practice and no treatment's happening, that's tough financially. That's, you're paying to keep the lights on, you're paying the staff to be there, and no production value is coming in from a patient who needs treatment. So now more than ever, these confirmations, they have to hit home. They have to land. Your patients have to show up for their appointments. So, if you do have short notice as to when you're going to be reopening, maybe you're going to be reopening next Monday, and you're thinking, okay, when do I need to turn my reminders on? Turn them on today. Turn them on today. If you are going to be open on Monday, turn them on right now. And we have articles in our community that show you how to do that if you're a Solution Reach customer. But and again, you have full control over the cadence. And we have articles and videos that show you how to modify that. But take that into account. Modify that cadence where you think you need to, so that patients are getting enough of these messages ahead of their appointment. Because if I'm a patient and my practice opens up Monday and I don't get a reminder until Monday morning, that could be a very frustrating situation for me as a patient. I may not be able to make that appointment, especially being made aware of it, very, very, very close to the actual appointment itself. So thanks for letting me ramble on that, Leah. That's something I'm really passionate.
No problem. We just touched on a couple of super quick things. One thing I wanted to add to what Addison said was, this is one of the reasons it's so important to send out some kind of comprehensive, hey, we're reopening and here's what you need to know communication to your patients. Some kind of group text or email that sort of says, here's kind of the basics. If you were postponed, we are going to be doing X, Y, and Z. If you have an upcoming appointment, you are still scheduled and you'll be receiving a reminder. Here's some additional information about changes to our office. That sort of ahead of time communication to everyone, I think, is going to be very critical, especially for the appointments coming up. We've had a lot of questions about pre-visit instructions and how to use those. And I just want to quickly touch on a couple of critical things. One is, many people have asked if those are sent out both in text and email reminders, and yes, they are. So when you create those pre-visit instructions in Solution Reach, they go to the patient in either one of those mediums. And then from the perspective of how to send or set up different pre-visit instructions based on the type of appointment, that process can be found in the community as well. There are knowledge-based articles that kind of talk about how to turn on and set up those pre-visit instructions. This comes back to something that is really important related to telehealth, which is that one of the most important things you need to do if you are going to be doing any kind of teledentistry is ensuring that when you are ready to do that, you have set up the right appointment types. So not only have you verified with your payers and your state regulations and made sure that you're okay to do teledentistry and that you will get paid for that by your various payers, but also that you have set up the correct appointment types in your schedule, and that kind of flows forward from the scheduling all the way through the billing process. So, and then those schedule types, right, those appointment types are also what will help you ensure that you're getting the correct pre-visit instructions into those different visit types. So that's a really important piece of that. And again, as Addison's been kind of saying, and we've been saying all along, if you're currently a Solution Reach customer, you can get information on how to do that in the knowledge base, which is really important. If you're not currently a Solution Reach customer, we would strongly encourage you to use pre-visit instructions. The whole process of ensuring that people know they're supposed to let you know if they have symptoms of COVID, or that they need to wait in their car to receive instructions to come in, or, this is a long list of things that may be helpful to have some kind of pre-visit instructions set up for. It really is kind of more important now than probably it's ever been. And also related to reminders, we had a couple people ask in the previous webinars whether or not people track their no-show rate, and they were just interested to know in kind of a poll, do you track your no-show rate? And if so, what is it? So we decided we would go ahead and push out a poll about this. And while we're pushing out the poll, there were a couple of things that I wanted to mention. One is that over the years, there have been obviously many studies about no-show rates. and we do know a lot about kind of average no-show rates and what they look like for different industries. If you're interested in getting a sense of kind of what the impact of your no-show rate is, we actually do have a calculator at solutionreach.com in the resources section. There's like a no-show rate cost calculator, which can be really helpful. But what some of the research has shown that is very interesting is that most people underestimate their no-show rate, that the majority of practices don't effectively track it, and that when they are asked, the rate they give is considerably lower than what their actual no-show rate is. So I think, just by way of kind of saying, it's super important to track your no-show rate, because you obviously can't improve it if you don't know what it is. And as human beings, apparently, we are inclined to reduce the no-show rate when we're asked. Okay, I'm going to push this out and share it with everyone. I think this is very impressive, and it makes me inclined to want to, I wish I had another poll in there to see how many of you whose no-show rates are at various levels currently use Solution Reach or a similar kind of system. What we have found in researching our own customers is that over 80% of our customers who use automated reminders do have a no-show rate of less than 10%, and more than half of those, it's less than 5%. So it really shows the impact of using some kind of automated system for no-show. Okay,
so that addresses that. Look at these results. If you're out there and you're thinking, man, you know, maybe for others the rate that you have is relatively low, but for you, you're thinking, I want to bring it down more. I want to improve this no-show rate. Again, once you get back up to speed, we totally recommend the 3-3-3 strategy for your appointment reminders. This is going to improve those confirmation rates, which the more touch points a patient has leading up to their appointment, the less likely they are to actually cancel or to no-show on you. If you're out there and you aren't using Solution Reach and you are doing the method that I used to do, where you are calling your patient a day before, I'm going to be frank with you, that's not going to cut it. You need to step up your game, and you need to look at more efficient ways and more effective ways to reach out to patients and let them know about their appointments. That's going to bring that no-show rate down and improve that confirmation rate.
And I just want to say too that if you were just guessing your no-show rate, as Leah said, you might be underestimating. So go and do a little research and see how close were you. If you thought it was 10%, you know, how close were you to your actual no-show rate? And I just want to back up again. Automation. It doesn't have to be Solution Reach. Sorry, don't let my bosses hear that. But you need something to be automating. Leia's my boss, so we'll pretend she didn't hear. But you need to be something to automate reminders. Of course, we love our system. It's amazing, but you need to be doing something, because otherwise your no-show rate is going to be bad, and it will really hurt long-term financially.
Yeah,
okay,
yeah, and this blog post here is a good blog post for kind of getting a feel for some of that no-show stuff. And then, like I said, we have the no-show calculator as well. I will say that actually the average for people not using automation for their reminders in dental is about 20%. So if you're not currently using automation and delivering reminders using like a kind of multi-pronged approach of text, email, and phone, your no-show rate probably is higher than you think it is. So worth mentioning again. So now we'll move on. This is depressing. Now we'll move on. Okay, so obviously during this time, we're getting a lot of questions about things like scheduling and intake and registration, because people who are trying to use teledentistry or who are trying to minimize contact to support the limited emergency face-to-face visits they're doing are really interested in trying to digitize kind of the patient journey in a lot of different ways. And so we've been getting a lot of questions about how to do that, including just things like, hey, can you even use online scheduling for, you know, when things are changing so fast and, you know, you only want to be able to schedule certain types of appointments. So Addison, can you talk a little bit about how people can kind of control that process, you know, or what control and customization they have available to them when they're doing online scheduling?
Yes, absolutely. So one of the most frequent questions we get It's based right around that. How do we control the types of appointments we offer? But along with that, many out there misunderstand the way that our solution works. The solution we have for online scheduling is called SR Schedule. And what this does, it's fully configurable. You can customize the appointments that are available, the providers that patients can select when they are requesting an appointment. You have control over over what they see on the schedule. So one of the most common questions we get is hang up solution or hold up solution reach. I don't want to give my patients free reign over my schedule to just drop appointments in wherever they want. That's not how it works. These are appointment requests. So when you have this system set up, your patients can go to this website, whether it's from their mobile device or their desktop or anything that can access the internet. Really, they go to this site that we provide for you, and they can request an appointment. They can request the appointment type that you have made available, the provider and the time, and that request is sent to you. Now you have full control over whether you're going to accept that request, or maybe that appointment slot just got filled, or maybe something doesn't work out and you need to communicate back to the patient and say, that's not going to work. We have these 3 other times. Do any of these work for you? So again, the control still lies with you. And again, we highly recommend making use of any method you can to make these processes digital. This is one of those things that I spent so much time on the phone, responding to phone calls that people called and just needed to schedule an appointment. And even though those calls sometimes take anywhere from 2 to 5 minutes, that adds up. That can really put a damper on other projects you're trying to accomplish there at the practice. So highly recommend, using an online scheduling tool. This provides convenience to your patients. It provides convenience for yourselves. I shared this example in the comeback plan, but think of it like going to fill your car up with gas. I love being able to drive right up to the gas pump, fill my car up, and go. That's convenient for me as a consumer. Let your patients do the same thing in regards to scheduling appointments. They shouldn't need to walk all the way into the gas station, pay the attendant, walk back out if there's a more convenient way. There's no reason that experience shouldn't live in the healthcare space. So.
Absolutely. And I think really right now we are just seeing that it's more important than ever, obviously, to just kind of get rid of bulky paper processes and passing things around. One of the questions that we've been getting a lot from people is, well, then how do I get someone's insurance card or driver's license? This is actually a pretty easy one. So in the online scheduling with our solution, they can actually take a picture of their driver's license and insurance card when they're scheduling. But you can also have people send that to you using SR Conversations. So if you're doing that 2-way text, you can do that. And then I have heard recently a couple of people who said, hey, why take a picture when you could take a video? So there have been some people who have said, why don't you just turn on video, show the front of your card, the back of your card, the front of your driver's license, the back of your driver's license. It actually is a great idea. So there's a lot of ways you can get that information through that digital process. And then also,
Leah, can I ask you a quick follow-up question on that? Because I know we cover this in the comeback plan of some of those providers out there saying, hey, it's not HIPAA compliant for my patients to just send me their insurance information. Give me a response.
You know how I feel about this.
I do.
So I won't go. I went a little crazy. This question came up in a previous webinar, and I was like, it's not HIPAA compliant. I will be calmer this time. So as we talked about earlier, patients are not covered entities. So patients can send you anything they want. They are not in any way restricted from sending PHI. They can text you a copy of their insurance card, their driver's license, a picture of an injury, information about how they're feeling, all those kinds of things. They can send any of that kind of stuff to you via email or via text. It's the continuation of the conversation so that you can discuss the PHI with them that requires consent. So once a patient sends you that stuff, really you just need to say, hey, if you want to continue this conversation so that I can do this back and forth with you, I just need your consent to discuss it with you over an unsecure tool like text or email. This is really important because there have been a lot of issues around HIPAA compliance over the last few years that the Department of Health and Human Services and the ONC and other organizations have been trying to address, because healthcare providers have been sort of overprotecting information. And so now it's sort of an issue of data blocking. And you can be penalized for not ensuring that patients have easy access to communicate with you about their healthcare or to get copies of their own information. So you want to be sure that you are not over-restricting against that communication to the extent that you might actually be violating HIPAA by doing so. So a much calmer response than last time, where I got very passionate and worked up about the importance of patient access. Super quick, I'm going to just hit one last question, which is a lot of people have asked about getting help creating forms if they're using SR Intake. So currently you, again, can get information about how to create your own forms through the knowledge base, and we're really encouraging people to do that. And the reason is because with so many offices reopening right now, our queue for customer service is really big, and we are doing our best to try to support everyone, but we don't have the resources right now to create intake forms for a lot of practices. So we're strongly encouraging people to use those resources to create their own forms. However, if you are really struggling, we do have our paid service. So there is a paid service people can use to help create SR intake forms and packets. You can ask for that option. We just are not able to just freely create forms for any customers who are needing forms right now. We just don't have the resources, along with trying to support this many offices trying to reopen at this time. That could change in the future, but that's kind of where it stands right now. So some general communications things that we want to touch on, because these are also really common things that come up a lot. And the first one is one I'm going to hand over to Lori, which is just talking in general again about some of the rules around being compliant with text and email. So Lori, can you kind of give us that quick summary?
You bet. Hey, I'm going to be fast on this because I know everyone loves long discussions of compliance. So there's two laws basically that deal with anti-spam. You've got the TCPA, that's going to cover like text messages, but phone calls, that kind of stuff as well. And then you've got CAN-SPAM, which is our email law. As for texting, what you really need to know is that with the under the TCPA, healthcare related messages are exempt from needing to get consent. Now, a healthcare related message only covers things that are related to care. So appointment reminders, confirmation, wellness checkup, post-operative instructions, post-discharge information, lab results, prescriptions, any of that kind of stuff is going to be, you don't have to have any sort of, express written consent in order to text them. But if you're going to be sending marketing messages, you are not allowed to send those by text messages or phone call unless you have received express written consent. So those are advertisements. So, oh, we've got this amazing new teeth whitening service, or invitations to events. Oh, we're hosting a big party for our patients, special special offers, things like that. You cannot send those by text message unless you've received written consent allowing you to do so. As for email, it's like way, way easier. You don't have to get written consent to send email. It's pretty easy. All you have to do is make sure you're not using false or misleading headers. You have an obvious way that people can opt out, and that you follow the rules for opting out, which is you've got to opt people out within 10 days. You can't use deceptive subject lines, respond to this email and we'll give you 10 cavities filled for free. Anything weird like that you can't do. And you can't include, and you have to include your actual physical address of your practice. I'm not sure why that's a big deal, but they want you to have that in there. I've actually spent days, weeks, hours.
I think it's to verify you're legit. I think it's about
you're
legitimacy.
Actually a person. So that's probably
you're a real place.
That's it. I spent like so many hours working with Solution Reach's attorneys, because they're not always the fastest, easiest people to get nailed down on exactly what. But I have an entire guide that covers kind of HIPAA TCPA, can spam. You just need to go into resources and look under like compliance, and you can read through all that as well. So that is the fast, short version of being compliant.
All right. So fast, short version 2 about recall. So this is a question we've been getting a lot too. So Addison, can you just quickly touch on sort of what people should be doing around, because obviously if you're trying to reschedule a bunch of people right now, it may not be the best time to turn your recall on right now. What should people be sort of thinking around kind of this getting back to a recall strategy?
Yeah, I think this is something to take into account with different types of treatments patients need. If you have patients who just need, their standard cleaning every 6 months, you may be okay to turn recall on for those patients, because hopefully 6 months from now, I know many are projecting we may see a second wave of COVID-19. Hopefully we don't, and hopefully you're going to be okay to see patients 6 months from now. But for those other patients who, for example, patients who are having scaling and root planing done, or other procedures that may require more frequent, visits at the practice, yes, you should modify the recall messaging. In fact, for some, you may want to turn it off completely. If you haven't ever touched your recall messaging or changed the wording or adjusted it, now may be a good time to do that, and just update it so that it is consistent with the message that you're already trying to communicate with your patients through other methods.
Yeah. So just be thoughtful, I guess is the bottom line sort of about recall based on your kind of your experience and sort of what's happening. Couple other things that we did want to touch on. A lot of people have been asking if we start using some kind of electronic bill pay solution, is that for only after we've, say, received EOBs or ERAs? Really important to remember that electronic bill pay should be used with the same best practices as any kind of bill pay. So make sure that you are verifying information ahead of time, that if the patient has some kind of patient due amount, and send them that electronic billing communication ahead of time to collect copays, just like you would in the office. So, think about those same, best practices for sure. And then lots of people have said, like, we're just not sure how to make sure patients know how to reach us right now if we're not in the office and we're not at that phone. Again, this is another place where those mass communications to your patients are really important, and making sure you're getting out some kind of general communication that says, here's what you need to know about getting care, about reaching us, about what services we're providing. Those are those kind of critical group or mass text and email communications that are so important.
And I just want to say on that too, I know we don't have much time, but include it on your social media, include it on your voicemail messaging, have something in the office on the door or something, have a set of things that when you're getting out general communication, try to reach them every way you can. Yeah.
It's just really important right now because it's so difficult. We do want to chat just for a minute about some social distancing things, and I'm going to let Lori take some of these, but it's really just about how do we, as we start to reopen, how can we try to maintain some social distancing, manage our waiting room, things like that. So Lori, can you take a couple of minutes just to touch on a few of the things related to this?
You bet. You guys, this has been so hard, hasn't it? Trying to figure out the whole waiting room thing. So as for managing your waiting room, I've heard a lot of people are doing it slightly differently. I think the most popular method is to go ahead and implement kind of the remote waiting room. You're actually closing your waiting room completely, having people wait in their cars, text message you when they arrive, having some of your assistants or practitioners or someone go out and do all the kind of fever checking you need and whatever, and bringing them back in. That's the most common method that I'm hearing. Some of it, though, may depend on the size of your waiting room. If you have a huge waiting room, there is the potential that you can open it back up, but you have to be so careful to make sure that you're keeping everybody the distance apart. So for all practices, I think a lot of kind of social distancing depends on the actual physical size of your place. So if you're tight quarters, you have to have not very many people in there at once. If you've got, if you're trying to set up people in different areas, getting into their dental chairs, trying to make sure that you've got enough distance from one patient to another. We talked about maybe only using chairs 1, 3, and 5 if you've got them too close together. Again, you're going to want to look at kind of the situation that's going on in your particular locale, as well as your state, what you're hearing from your area, because what's happening, in New Jersey may be really different than what's happening in Kansas. So some of that's going to depend on your location. Now, I have had a couple questions. I know we have hardly very much time and so many questions, but I have a couple things about if you have a lot of people who come to your office without cars, I would try to set up an area people can wait outside of your office with instructions as well. If you've got a covering,
and I think we do
up.
have I should have put those in here. We do have some posters that we developed that are for putting on your door. If you attended some of the previous webinars, we showed those that say, like, please stay outside. Some offices have someone outside directing people. Some people are putting like big stickers on the ground. You've probably seen those like in other places too. There are some ways to do that, and you can download those, I think, on our website, those posters too.
Yes, exactly. And so obviously when people are coming to pick stuff up, if you're, got Invisalign or you're doing something like that, you just make sure you're asking one person to come. You can even, best practice is to meet them outside to, trade off your supplies, dispensing things like that, as well as having stuff shipped to their house wherever possible.
Yeah, that's awesome. I do want to give Lori a chance to touch on a couple of these questions we've gotten about stimulus and financial relief and things like that. But first, really quick, because this is such a good question, and so I want to have Addison take this. Someone is asking, hey, we do want to start using some like newsletter type campaigns or marketing campaigns to start driving some communication and getting people, chatting with us. And they want to know if they can do more than one campaign at the same time. So I think this is a good opportunity to talk about kind of group messaging and different ways that you can actually target different groups of people. Can you take just a minute to talk about that, Addison?
I can take less than a minute, Leah. Yes. Okay. First and foremost, on the community, we have articles that help you go through the campaign process. We actually have a video as well. So search for those on the community. That'll help you get really acquainted with those. But you're right, Leah, you said that it relies heavily on groups if you want to have more than one campaign going. So again, use the community to learn about groups. We have training videos there on the community that you can learn about that, as well as newsletter campaigns. Those are going to be the two things that kind of go hand in hand. You need to create groups of patients that need to, it sounds like they need to receive different types of messaging, but then you need to set up your actual campaigns and create the newsletters that are associated and should be sent to those different groups of patients. I think I covered it in less than a minute, Leah.
Yeah, you totally did. And I have to say, it's a great question and a great thing to bring up, because it is important to think about, do different people need to get different information for us to effectively communicate with them and have the best experience? And the answer to that question is yes. So,
absolutely.
Good question. So very quickly, because we know people still have some questions about things like stimulus and financial relief and PPE, we're just going to super quick have Lori, because she's been doing a lot of research on these topics and writing some blog posts, hit on a few of these in terms of whether or not there's still stimulus money available, whether it's through the PPP or other sources. And many people have asked, can we use some of that stimulus money for PPE? So Lori, just hit this one as quick as you can, and then we'll try to jump over to the last slide.
You bet. Yes, there's still money available. When the second round came out of the PPP money, there is currently money available. I recommend that you go through your local bank. That's what I've heard is the easiest way to do it. And we've also worked with a company called Funding Circle. They've really helped me a lot with a lot of my financial questions, and I talked to them, and they are accepting applications as well. So if you have questions on that, I can follow up and help you with that. Can you use stimulus money to buy PPE? So it depends on what we're talking about stimulus money, right? If you're talking PPP loans, the answer is no. Okay, so PPP really has some very specifics. It's mainly for paychecks, but 25% of it can also go to things like your rent. There's just only a handful of things, and that does not cover PPE. Okay, so the answer for that is no. But if you are referring to the $100 billion Public Health and Social Services Emergency Fund, PHSSEF, for assistance with for healthcare
Because we need
providers.
more acronyms.
I know, right? The answer to that one is yes. Okay, so there is funding out there that's been made available to try to help with PPE. That just comes from a different fund. So do not use your PPP money to buy PPE. I'm sorry, that's a lot of P's. And finally, the last question that you were told you couldn't receive both the EIDL and the PPP, or they'd be deducted from one another. That is, what will happen is the grant money would be subtracted from the total forgiveness of your PPP. So that is true. You can get them both, but the EIDL will be deducted from your forgiven money from the PPP. One final thing on PPP is that I totally recommend that you put it in a separate bank account. It makes it way easier to track exactly where that money is going. Open a whole new account just for your PPP money, and that way you can track those expenses better. I know there's a ton of questions on this, so send them in and I'll follow up. I can follow up with a blog post or more videos as you know.
Yeah. And I know we're not going to get to all of these because we've just had so many good questions and we haven't been able to cover everything, but there are a couple last quick ones as people are starting to drop off. I just want to quickly touch on. One is a couple of people have asked about refusing service to someone who appears sick. I think it's really important to remember you're not refusing service. What you are doing is setting some clear guidelines about who can come into the practice and not, and then what they should do if they are sick. So if you are, this is one of the reasons it's so important to have those pre-visit instructions and pre-visit screening and all these different things that you're doing, is to make sure people understand if they have a fever, if they have a cough, if they have any of these symptoms, they need to call you ahead of time and let you know. And if that is the case, you need to give them some clear instructions about what to do, where to go, see their doctor, go to the emergency, whatever the kind of basic guidelines are for where you are in terms of whether or not people can get tested with or without a doctor's appointment or those kinds of things. You want to be able to provide that information to them. So I wouldn't call it refusing service. I would just say you're doing your best to care for your patients and letting them know what they need to do if they're sick. And then a couple of others that I think we do want to touch on really quickly, Lori, because this is one we've gotten a ton, is this question about should we be charging our patients for PPE?
Yes.
So for those of you who are sticking with us for a couple extra minutes, it's probably because these are the kinds of questions you still have. Can you just quickly touch on that one?
Yeah, and we actually, legally you can. Obviously follow your local state guidelines, everything you can, but we actually have had quite a discussion on this ourselves internally on if you should charge your patients, and our consensus is no. It's just right now is such a hard time with patients. I know that you guys are having to pay tons of money for all of this PPE that you've never needed to use, and it is ouch. But at this point, what I would do is go ahead. You can file to the insurance. You can charge the insurance. The vast majority of the time, they are not going to cover it. Medicaid, Medicare, they do. But what you need to do is go ahead and bill for it, and then just let your patients know you're writing that off. That's going to build some trust in you. That's going to make them, it won't be so off-putting and distasteful that you're charging a PPE fee. All of this being said, if you have a specific demographic, if you're dealing with a lot of cosmetic stuff, if you've got really high-end clients, I think that you're probably okay in putting in just a PPE charge. However, for the vast majority, I think it's going to be off-putting. I think that in a time when you need to be solidifying your patient relationships, it's going to create more problem than you want to deal with. But continue to honestly, go again, always submit it to the insurance, because not only does that, are you able to say you're writing it off and look good, but if there's a chance that at some point legislation comes out saying, hey, you do have to cover PPE, insurance companies, payers, it would be great to have that record backtrack of what you've submitted.
Yeah, absolutely. And as far as the guidelines, because a lot of people have asked about guidelines, look to your specialty organizations as well as the CDC for clear guidelines about what you should be doing for your specialty or for your area. Also look to your state and local health agencies for any additional guidelines they have. It's varying so much by specialty and by location that it's really kind of unfortunately incumbent on you to sort of look at what you need to do in your specialty and in your area, you know.
Yeah, and I wanted to make sure that everyone was aware that just in this last week, the K995 masks that were previously approved have been removed from the approved list. I know a lot of dental practices have been really hit by that. So just go online on the CDC website. They have a list of approved masks. The KN95, those are the ones that came from China. They're kind of our Chinese version of the N95. And it turns out that most of them are faulty. So those are no longer approved. It's ouch for lots of us who have ordered
bummer
those.
Thing that I know, trying to keep up with everything is such a bummer. So I know that we didn't get to a few questions. We did try to get as many as we could. I do want to just remind everyone that you will get an email with a link back to this recording if you want to share it. You can find a lot of the resources we talked about today on solutionreach.com in our resources section. And then, of course, we talked a lot about using the community and the knowledge base. If you would like someone to follow up with you about any of the solutions we talked about today, from just the general Solution Reach platform all the way through these other things, we have put a question in the exit survey, and you can say, yes, have someone contact me. Same goes for practice comeback resources. So there is a practice comeback playbook. There are all kinds of downloads and handouts. If you would like someone to send you the link to get all of that, we can do that as well. So just say yes. If you're a customer, you may have already received an email with those links, or you may receive an additional link later. So just, you know, be aware that those may come through, and that's what that is. Those are the those are the resources that we've been talking about today. But you can also say yes on the exit survey as you're leaving. And then additionally, here is some contact information if you want to follow up now and ask more about any of these solutions. I will say, I do want to reiterate that we are currently experiencing extremely high call and chat volume to our customer support because so many people are reopening right now. And so it might be better just to say, yes, have someone contact me, and just wait for someone to reach out to you instead of trying to contact support right now for something that's more like, I want to learn more about telehealth or something like that. And then for non-customers, there's contact information here, phone and email. So thank you so much, everybody, for joining us today. Thanks, Lori and Addison, for hopping on with me and answering questions.
Absolutely.
And being here. Yeah, it was great. And I just had some more people say, can we confirm there's a recording? Yes, there is. You will get an email with the recording. So I know it's funny. I feel like no matter how many times you say that, there's always somebody who's like, I just want to be sure. Can I get the recording? You can.
And I want to say as well, I know there's a ton of questions. Please feel free to reach out and ask. We have a YouTube channel where I work to answer all your questions on video. I try to put out blog posts and even just respond directly to emails when you have questions about this stuff. I know it's super hard and we're like rooting you on so much. So please feel free to reach out and we'll do what we can to help.
Yeah, absolutely. And that's actually a great suggestion. Through the blog, you can send comments and emails to Lori, and she'll, try to put your questions into future blog posts or do some of her FAQ videos using customer questions. So it's a great way to get more information. Okay, so we've kept you guys over. We're sorry about that, but I'm glad we were able to answer most of your questions. And thanks again, everybody, for joining us today. And we hope to see you on webinars again in the future. Stay safe, everybody, and have a great day.